when certain things happen through, that communities, are faced with, for example, the last bout of H1N1. While we all of us sort of scurried and worried, folks from the health unit took on the huge responsibility, and you know what, they got some criticism. But when I look at that criticism, that's because they were doing something. Because if they were, if you don't do anything, then you don't get criticized. And I see Mayor Thompson is nodding her head. So, it's like referring to a policeman or a firefighter. When you have a problem, these folks run in and we run out. So, and they have no idea when that happens. Frankly, I mean, sometimes we can guess a little bit, or the magnitude. But, we, during H1N1, our office try to keep in touch because we get a lot of calls as well. And the professionalism that was shown during that time, it's hard to communicate that. So, you're right, you do a lot of things behind almost that wall that nobody sees, which is fine. But so for that part of it, we need to have a little bit more of appreciation for what these folks do.
I could pick up on your comment. You talk about the fire and police when they run in, everybody else runs out. I think when we run in, people should stay.
We run out because we're scared.
I know. But in public health, when we run in, you should stay and work with us.
Perfect.
The province has announced that it's providing every single health unit in the province to public health nurses to address determinants of health issues within their health units, addressing issues around priority populations, which include access to care and the determinants of health in a broad kind of context.
We were delighted to be here at the health unit today to announce some $170,000 in permanent funding to hire 2 more nurses, to expand really the scope of service that they already provide. My understanding is that over 40 nurses within the organization. But as new challenges come forward, whether it's health promotion, which they do a great job at, or to do consultation with some folks, or attend schools. This is some additional tools, you might say, or an expansion to what they already do, to be able to provide the service even more. So this is the 2 nurses here today. It was part of 72 nurses announced across the province, and I was delighted for this particular health unit to have 2 additional ones, which I know they'll put them to good use.
This is terrific news, and it's always nice to get funding from provincial government to help us out. We do a lot. Like what you mentioned earlier, I've learned a pile of information that the health unit does, things that I didn't know they did in the past, and they continually work hard to work with other organizations to make life better for everyone within not just our municipality, but throughout all of Ontario. So it's good to see this funding come forward. It's good to this is going to be for our local community. And these nurses are going to come in very, very handy for this area, definitely. So we do thank you for that.
Thanks, Mark.
Well, we're thrilled about this. We need to figure out how to best utilize these positions to get the best work out of them to address the many issues that we see within our geographic areas around determinants of health.
Well, I mean, this, once again, health units in general, and like I say, I mentioned before, I had the extinct privilege to be a board member here back in my municipal days for about 4 or 5 years. And I know I learned firsthand some of the great work that health units do, especially to be on standby when we have issues in the province, like H1N1, where they stepped in, and this right across the province under the direction of the Ontario Medical Officer of Health. And they took on that challenge. Plus doing their daily jobs, whether it's before, flu shots in fall. So with this additional money, this will really extend their scope to provide even a better service for our communities.
They'll be involved in policy development, ensuring that our staff make sure that their services are accessible to the entire public, to priority populations, conducting surveillance or monitoring trends, looking at the data for our area around issues that determine why people are healthy and why they're not.